I think the most important thing for patients to remember in dealing with plantar fasciitis is to not give up. Be patient and things will get better. So tell me about your foot pain. When did that start?
Well, I've had it off and on. It comes and goes, and it started about 3 years ago. But now it pretty much is here to stay for about the past year.
Did it start with any injuries or?
Not that I know of. I was hiking one day and I said, you know, I have this really strange heel pain, and a friend of mine said, oh, that could be plantar fasciitis.
Over a person's lifetime, about 1 in 10 are probably going to develop plantar fasciitis, so it's a very common problem overall, particularly in the runners or people who work a lot on their feet. They're the ones who are really at risk for developing this, yeah. Patients with plantar fasciitis tend to have symptoms referred to the plantar surface of the foot or the bottom of the heel. Their pain is usually worse in the morning with the first steps when they get out of bed, and can be worse throughout the day if there's somebody who stands up a lot throughout the day or does a lot of activity throughout the day. Have you done anything that's helped it over the past 3 years?
Lots of things have helped it, and in the past those things would make it go away, but it hasn't been going away. It hasn't responded. I've done things like ice, rolling my feet on frozen water bottles. I've eliminated high heel shoes. I have custom orthotics. I've even done about 6 weeks of physical therapy, and all of those things helped it, but nothing has made it go away completely.
The causes of plantar fasciitis can be multifactorial, but essentially what it comes down to is degeneration of the plantar fascia, which is a thick band of tissue that starts at your heel bone and stretches all the way out to the toes. Stretching, which is the most important thing, there's a plantar fascia specific stretch that I'll show patients how to do appropriately. Occasional anti-inflammatory use, maybe some inserts into the shoes like heel cups. A night splint is often very important, something that you wear that keeps your Achilles tendon and your plantar fascia stretched out throughout the night so that it doesn't have that pain in the morning when it stretches out with first steps. Like most treatments in orthopedics, I don't think that there's one specific treatment regimen that works for everybody. There's generally what works and what we try to focus on, but we do definitely tailor the treatment for the patient. A lot of patients can get frustrated with treating plantar fasciitis because it's something that can take a while to resolve. I like to recommend 6 to 12 months of treating this with non-operative options before we talk about surgery, and a lot of patients, particularly active patients, that can be a frustrating time to put your activities on hold or at least have limited activities while you're focusing on treating the plantar fascia. I think that we can minimize the frustration and improve the success of the treatment by making sure that patients understand what exactly it is that we want to do. We take a lot of time to explain to them the correct techniques and how to do the stretching, when to do the stretching, and other options that we're treating them with. Make sure that they really understand what the problem is and why it is that we're treating it that way.